Renewed pressure on Democratic presidential candidate Hillary Clinton on the downsides of Obamacare. This follows the recent announcement by the big health insurance company Aetna to reduce its participation in the Affordable Care Act's exchanges. Wall Street Journal reporter Laura Meckler says the renewed pressure is coming from both the left and the right. Laura, what's up here?
Well, I think that health care, of course, has been a signature issue of Hillary Clinton's for a long time. She tried to reform the health care system when she was First Lady. That obviously did not succeed, but she's worked on health care since then. It's always been an interest of hers. But really it had not been much of a focus of this campaign. She and her advisors concluded that, after years of acrimonious debate following the Affordable Care Act, she really preferred to try to move past that and come up with some more changes and proposals that were more dealing with healthcare on the margins, like, for instance, controlling costs, controlling out-of-pocket spending on the part of consumers. So, anyway, that was her view going in. But, it's become clearer that it's harder and harder to avoid this subject. She has pressure both from conservatives, from Donald Trump, who's saying that, this all shows the law is doomed and terrible and needs to be scrapped, and then she's in a position of essentially having to defend it, which she supports the law, even though, of course, it has some problems. On the other hand, she's under pressure from liberals who say that, this is proof that we need to, have a much more dramatic change. For instance, some would say we still need single-payer health care, like Bernie Sanders said, or others are pushing hard for her to follow through on her support for a public option, which would be a government-run health plan that would compete with these private insurers. So she is for that, but the question being, how big of a priority will that be for her? So far, we haven't gotten the sense that it's much of a priority.